families.
A dramatic...
And George is about to do a feedback interview.
Good morning, everyone. Welcome to Feedback on CKLQ, and we have a good week line for you. We'll start with tomorrow's show. Garth Turner is back. You may know him from the Turner Report on finances and financial matters. On Wednesday, Valentine's Day, we'll have an appropriate program, we think. It's a little bit more about the 2002 Scott Tournament of Hearts that's coming to Brandon, or should I say back to Brandon. On Thursday, the Farmers of North America as an organization, what they're all about. And then on Friday, Lorna Van de Haeg will be here to talk about drug-resistant bacteria. And very interesting. We'll be telling you some things I don't think you have heard before, and some things that are going to surprise you. The antibacterial soaps and wipes and everything else could be doing you more harm than good. Today, we're going to talk with a fellow who's tromping across Canada to raise awareness of organ transplants and tissue transplants. We've had a program last week on this. This will be part 2, and we'll get on with it after our break. Back in a moment. I'm across the table from a couple of guests this morning. One we're going to hear quite a bit from, and the other one we're going to hear a little bit from, but maybe not as much. First of all, good morning to George Marcello. How are you this morning?
Good morning, Bill. I'm very fine, and good morning, Brandon.
Yes, you've been here for a few days?
Since Friday.
Yeah.
We haven't had a chance to rest yet.
And the other person I mentioned is Branda Avis. Good morning to you.
Good morning.
You're assisting with this cross-Canada tour.
Yep.
And enjoying it so far, I understand?
Oh yeah, I'm having a great time.
All right. We'll get back to you in a few minutes here, but George, tell us what you're doing and what you're trying to do in what you're doing.
Well, I've undertaken a very big project. I'm walking across Canada to address the critical shortage of organ and tissue donations. Canada at this point ranks as one of the lowest in the whole civilized world, and I'm hoping, along with Branda and the rest of the road crew and all the people and volunteers, to change that. We want to raise the level of awareness and consciousness to the public from coast to coast, and also inspire and encourage all 3 levels of government to take a more active role.
Now, you have a personal stake in this. We should let our listeners know.
Yes, I do. 5 years ago, I was rushed to the hospital with liver failure, and at that point, I was told that I only had 2 days left to live. My only hope was a liver transplant, and I knew too well at that point also that the odds were against me, because I knew that Canada had a big shortage. 3 years before that, I was diagnosed with liver failure, with terminal liver disease, and I was sort of preparing for that moment. So I pretty well counted my blessings and made my peace. Now, the next day, I was very fortunate to have received a call saying that there was an organ available, and the only way that happened was because somebody passed away, and the family was approached and made the very unselfish and courageous decision to think of others at a time of grief and shock. And they ended up saving my life and 5 others. So I knew that if I wanted to get out of that hospital as soon as I could, because I wanted to do something about this shortage.
Now, somebody who's planning to walk across the country must be in reasonably good condition. I presume everything's working well health-wise?
Yes, so far I've had my physical challenges, though, especially with this cold. I've gotten frostbite about 5 times. While I was walking in Selkirk, my nose almost fell off. It was something like minus 55 that morning. But I'm a fitness promoter, so I think that's helping out, and you know, and I keep focusing on the people that are on the waiting list right now and how desperately they're living right now. And
so where did you leave from?
I had my big kickoff in Toronto on June 20th, and our mission was to visit about 500 cities and towns. So it's not a straight line that I'm doing. I'm going southeast, north, all over the place.
So where then do you hope to end up and when?
Well, right now we're headed towards Victoria, where we're hoping to arrive on July 27th. And we're also making arrangements with the military. Nothing's confirmed yet, but it looks very optimistic that they'll help us with a flight to Rome and London, where we're hoping to get audiences with the Pope and the Queen. And after that, we'll get dropped off at St. John's, Newfoundland. And from St. John's, we'll continue our walk through the Maritimes, through Quebec, and then back to Toronto, where we'll be finishing at around January 16th, 2002. But I also want to take this opportunity to say that at that point, on January 16th, 2002, we're going to look at what our rate is as far as organ donations, and we're going to look at what the government has done as far as taking some active roles. And if it doesn't look optimistic at that point, I'm crazy enough to keep on walking until they do.
You know, without me telling you, that this cross Canada thing has almost become old hat, and as such, it sort of makes it difficult. I think some people are disappointed in the attention that an effort like this receives. I wonder how you feel about the attention you're getting and the support you're receiving.
We've had our frustrations because it sort of has become a Canada thing to do these walks or treks or anything across Canada. But that's one of the barriers that we don't let stop us. And as a matter of fact, it's been the contrary. We have received a lot of attention, and we feel that as we're moving along, it's getting bigger and bigger, because what we're addressing here is something totally different. We're actually trying to do everything we can to give that person on the waiting list a fighting chance. So in that respect, I mean, the walk is one aspect of getting the attention of doing a trek across Canada, but the focus really is on organ donations and having people become more aware of it and knowing about the benefits and trying to inspire our governments to take more active roles. So I think looking at that point of view, it hasn't discouraged us, with the amount of attention that we were hoping to get. I think as we're moving along, we're doing pretty good.
Yeah, and I guess it's an issue too that people realize they don't know a heck of a lot about. Most people anyway. You were telling me before the program that there's a tremendous percentage of people that just simply aren't aware of our system, how it works, and how they can become part of it.
Well, most people that I've talked to aren't sure where they can sign their card, whether it's on the driver's license or a health card. It changes from province to province. And one of the problems, once again, that our governments are failing to do is inform the public when a change does get made. In Ontario, for example, they changed the donor card from the license to the health card, and they didn't let the public know about it.
Yeah.
So the idea is, though, to have either, whether it's a driver's license or health card or donor card, to sign the card and keep it on your person, in your purse or in your wallet, so that it could be found during the time of your passing.
And let the people know that are close to you.
That is extremely important, especially at this point, because we have a problem of not training our police officers and our hospital officials properly. So when it comes to approaching the family, it's at a very, very bad time. A family is usually grief-stricken and in shock, because usually an organ is available after a tragedy.
Yeah.
And to approach the family at that time, you're not going to get them in their right state of mind. And what's happening most of the times is the family is even actually vetoing the decision because of the timing. And I've talked to